Pleasant good afternoon to all. My name is Cuthbert Knights, the Permanent Secretary in the Ministry of Health, Wellness and the Environment. And I once again greet you all who are logged into this press conference. We have promised you that we will be making a weekly press conference. This press conference was scheduled for last Tuesday. Unfortunately, we had to reschedule that to the Thursday. We initially had scheduled this as well for 2 p.m. today, but we do apologize that we had to bring it forward to this time in the morning session. I also would like to let you know that our Honorable Minister of Health, Sinclair Jimmy Prince, is also with us. We'll also be having presentations today from members of the Ministry of Health, and then we will have our Honorable Prime Minister who will speak at the end of the presentations from the technical persons within the Ministry of Health. Again, the purpose of this press conference today is to provide you with further updates on COVID-19 here in St. Vincent and the Grenadines. I will therefore ask our Honorable Minister of Health, Wellness and Environment, Mr. Jimmy Sinclair Prince, to give some brief updates from our last conference. Minister.
Thank you very much, PS, members of the press, members of the general public here of St. Vincent and the Grenadines, all those who are listening to us or viewing us on the internet. Let me say a pleasant good morning. I'm honored once again to be with you to talk about this very significant and important issue to the welfare of St. Vincent and the Grenadines. Since we last met, we formally embarked on another phase in the fight against the pandemic COVID-19. We published statutory rules and orders which contain some new measures, including ticketing for certain actions. This is an attempt to tighten and enforce restrictions which we think will help us flatten the curve of this pandemic and in the process keep our population safe. Of course, we have restrictions on public transportation with respect to the number of passengers and the wearing of masks. We also have restrictions pertaining to restaurants, bars, and other places of entertainment and gathering. Masks are mandatory in public places and places where the public have access. Of course, we have attached a penalty, $100 for the individuals, $500 for the hosts, depending on the infraction. We will soon enter a next phase with a focus on vaccination. We've already been preparing for this phase, and this entails procurement, training, storage, execution. There's already a committee set up to engage the nation and to prepare people for this phase. Excuse me. I'm sure that if we adhere to the protocols and take responsibility for our own health and well-being, we will be able to defeat this pandemic and adequately navigate our way through this special period. I'd just like to look at some of the areas that we have been working on over the period since we last met. Our flu clinics, at least one within each health district across St. Vincent and the Grenadines. The flu clinics are open Monday to Friday, 8 a.m. to 4 p.m. And that's except for the KINGSTOWN clinic, which runs from 8 to 7. And on Saturday, 9 a.m. to 12 p.m. Of course, we hope that the public will take advantage of this opportunity to deal with their public health, because these clinics are open for your service. Our newest equipment to enhance our testing capacity at the Milton Cato Memorial Hospital, that piece of equipment has arrived. We have tested it, and it is now in operation. Of course, Mr. Elliot Samuel, our Chief Laboratory Technologist, will address this morning as well. But suffice it to say that we have increased our capacity to test and to give you results on a timely basis, because we have, as we've said before, we have employed some 4 technologists from Cuba, and we have acquired this new piece of equipment. We have increased our surveillance at the district level, and we continue to encourage anyone with flu-like symptoms or a contact of a positive case of COVID-19 to seek care at their nearest flu clinic. We have intensified our risk communication in collaboration with a number of private and public sector engagements. The Health Services Subcommittee COVID-19 Task Force campaign, Hand, Space, Face, Vaccinate, which is designed to focus on specific measures which have been proven to reduce the spread of the virus which causes COVID-19. Of course, we said before that we are seeking to have private sector collaboration in this matter because it is something that we cannot do alone. We have to have the buy-in from the private sector and the rest of the general public. I'm sorry if if I have a little sniffle here. It has nothing to do with COVID, I assure you. Even as we continue the general COVID-19 health education activities, special focus must now be given to the North Windward and North Leeward communities because of a noted increase in the spread of COVID-19 in those particular areas. In addition to that, the ongoing threat of an explosive volcanic eruption. So we have been doing some targeted work in those areas. Yesterday, we were in North Windward, and we intend to go to North Leeward very soon. Just to look at the Hand, Space, Face, Vaccinate campaign, this is focused on the promotion of proper, consistent hand hygiene by providing the information and the means to utilize that information. Space, the maintenance of sufficient physical distance in all spaces will be reinforced by the placement of appropriate signage in both urban and rural areas. Face, increasing the capacity of everyone to consistently and correctly use facial coverings and so comply with the effective way of reducing the spread of COVID-19 in all our communities. This intervention is specifically aimed at increasing the mask/facial coverings uptake, not only in the urban areas, and particularly in Kingstown and on public transportation, but in the communities where people live. And lastly, vaccinate. COVID-19 vaccines proven to significantly reduce the risk of moderate and serious diseases will be available to the frontline workers and the willing general public in St. Vincent and the Grenadines. So we are preparing in this way by constructing a facility in that area. You will soon see the demolition of that particular area soon. I will implore us all to play our part in helping to mitigate further spread and continue to be safe during this time. The other members of the panel will update you on some of the specifics with respect to the technical issues around COVID-19. And we will continue to do so. And we continue to bring the people who are directly involved to you so that you'll be able to ask them questions and they'll be able to bring these issues closer to you. I thank you very much, and I hope that you will be clearer after the end of this briefing.
Thank you, Minister. You have been working ever so hard since assuming this post of Minister of Health. And it is again a show of leadership within the Ministry of Health here. And just to reinforce to the nation that we stand united in the fight against COVID-19. And as we fight together, we know that we will prevail over this pandemic. We will have our most senior statistical person within the Ministry of Health, Mrs. Maxine Glasgow-Cottle. She will present an update in the latest numbers as they refer to COVID-19. Mrs. Glasgow will ask you to speak at this time.
Hello, good morning. Honorable Minister of Health, Mr. Sinclair Prince,
can proceed, Mrs. Scottle.
Dr. Ralph Gonsalves, Honorable Minister of Health, Sinclair Jimmy Prince, other health officials, the press, good morning. This morning, I'm going to speak to you about the situational report as updated this morning. We'll look at the cases by dates. I'll then look at the cases with no travel history. I'll then focus on the distribution by gender, age group, and health districts. Following this will be the daily cases by health districts. I will now share my screen with you.
Mrs. Glasgow-Cottle, your mic is muted.
Are you hearing me now? Hello?
Go ahead, please. Go ahead.
Okay. So at this time, I'm going to share with you the situational report since we last updated the cases last night. Since then, we have seen 6 new cases, and 2 of these cases are linked to existing positives. 555 cases are under investigation. We have 903 active cases. So far, 467 persons have recovered, and we have 6 deaths. Sorry, okay. I'm now going to look at the cases by dates since December 16 to February 11, 2021. So if beginning in December 16, there was a minuscule increase, and this went towards December 20th. If you look at the data has trended down, and it did so until December 26, after which there was a slight increase. Then data leveled off around the 28th and the 29th of December. The curve was again flattened in December 28th to 29th, and then it went down. The curve then began to flat, and then it increased. Over time, you will notice that the graph is showing an upwards and downwards trend. We experienced a peak on January 28th, of which there were approximately 115 cases. Since then, you will notice that the cases recorded are decreasing for the most part. I will now look at cases with no travel history. Now, this is cases by age group. And since the last time we reported, you will notice that female trend continues, whereby females are far greater than that of males by 15%. 41% of the cases recorded are males, while 56 are females. And we are still seeing cases without data, hence the category of 3%. Cases by local cases, sorry, by age group. Now the distribution by age groups, they are concentrated in that small area again, between the age groups 15 to 24, 25 to 34, 35 to 44, and 45 to 53. Most of the cases recorded are present in the 25 to 34 age group with 237 cases. This accounts for 19.38% of the total cases. Age group 35 to 44, there are 206 cases, that is 16.84%. This is followed by the 15 to 24 age group with 173 cases, and that accounts for 14.15%, and then the 45 to 54 year age group with 12.51%. I will now look at the COVID-19 by distribution by district. And we're going to share with you the data as we did on the 26th and compare it to that of February 11. So we continue to see that the distribution of the cases in most parts is they are in Calico, Pembroke, KINGSTOWN, MARRIAQUA, and Cedars. Calico remains a district with most of the cases, 17.50%. This is followed by KINGSTOWN, which recorded 17.42%. Then Pembroke with 16.52%, and MARRIAQUA with 11.77%. You will notice that there is a shift here in position in that Pembroke is now the district with the second most high cases. KINGSTOWN is, and then followed by Pembroke and MARRIAQUA. You will notice that Georgetown has decreased significantly with 8.09% when compared to the last report. Now, this graph actually is related to the previous slide, and you will see here that Calico, of course, has the most cases, followed by KINGSTOWN, Pembroke, MARRIAQUA, and then Cedars. Now I'll look at the daily cases by health district. We'll begin with KINGSTOWN, and you notice the line graph. From January 3rd, there was a slight increase going upwards. If you look generally at the graph, you will notice that KINGSTOWN has both an upward and downward trend with a peak on January 21st. On January 21st, KINGSTOWN recorded 25 cases. We'll now look at Calico, and Calico exhibits the same pattern as KINGSTOWN with the upward and downward trend, peaking on January 28th with 19 cases. The MARRIAQUA district recorded most of its cases on January 27th with 13 positives. The upward and downward trend continued here. The curve, if you can notice here, the curve was flattened just around January 31st and went to early February. Then there was an increase seen here. Cedars Health District, again, we see the consistent increase and decrease in cases. The cases peak on January 9, and again on the 22nd, where 13 cases were recorded. We'll now look at Georgetown, and if you notice, Georgetown has a relatively low curve generally, and then there we experience that high peak on January 28th with 23 cases. Pembroke Health District, the trend continues in this district, the upward and downward pattern. 8 cases on January 8th, 19 cases were recorded. It is, however, important to note that also on January 20th and 28th, 18 cases were recorded on both of those dates. CHATEAUBELAIR peaked on January 28th with 14 cases. Prior to that, you will see that the curve was flattened on two, well, the curve was flattened just before, and it was flattened on 2 occasions, just before the peak here and immediately after. The Northern Grenadines began with a flat curve. Then the cases increased. They went up and then down. Then you can see a flattening of the curve here around just after January 24th. And then again, from January 25th, we continue to see a flattening of the curve. The peak here indicates that there were 5 cases on January 14th. Southern Grenadines has a consistent flat curve where there are only 2 cases. Thank you very much. Just to remind you that cases are in all 9 health districts. So please be mindful of this as you traverse this beautiful island of ours. Take the necessary precautions, wear your mask, wash your hands, practice social distancing. Thank you very much.
Thank you. Thank you very much, Mrs. Cottle. And once again, as we demonstrated, we do have the capacity in this ministry and this nation to respond very boldly and strongly in our defiance to this pandemic. And with the support of the state also is responding via our national response, and it is quite vivid for everyone to see what is being done, and we will prevail. Rest assured that we are very consistent and resolute in our defiance to overcome this disease, and we will do so. We will now ask our Chief Technologist, Mr. Elliot Samuel, to give us on it refers to situation at the lab and our efforts to battle this disease. Mr. Samuel.
Protocol having already been established. Good morning, all, and it's really a pleasure to be here updating the nation on the current situation in terms of laboratory capacity and diagnostics at the molecular laboratory unit for the Ministry of Health. Without a doubt, laboratory services is one of the key components of our response to COVID-19. And I know a lot of persons are anxious about how we stand in terms of our capacity to test and detect the virus. We were recently experiencing some issues in terms of keeping up to date with our testing capacity. And I am happy to announce that the Ministry of Health has assisted us tremendously in overcoming this challenge. And as of about the 1st of February, we were really on track and on target in terms of turning around, I would say 95% of the tests that we receive within that 24 to 48 hours period. I say 95, 98 because we do have some challenges at time with a few samples that we have to hold back for further testing. Some of them we have to send on to our referral labs for confirmation, etc. So you may from time to time see numbers being reported as of a few days ago. But we are working assiduously to overcome those kinks in the system, so we are going to be fully up to date. Just to say that some of the things that contributed to us getting out of what I would describe as a rut would be, firstly, the new staff that we received from the Ministry of Health. We were able to get 4 additional set program persons who we injected in our system as clerks. So we were able to take away the sample sorting bit of it and to have that done by the set program persons. We actually got a separate physical space, so we now have that streamlined in a container just outside of the laboratory space. In addition to that, we also received 4 technical staff from Cuba, and those staff they are now in lab. They're actually going through the orientation process with us now, having completed the quarantine period. And I must say that they are performing quite fine. And when we fully integrate them into our system, we will be able to take on the much anticipated 24-hour shift that I know everybody is waiting for. In addition to the staffing additions that we received, I think most critical to the process was where we were able to automate a critical part of the process, which is the extraction. I don't want to get into too much technicals with that, but just to say that the automated instrument has allowed us to basically cut that extraction process in half. And when we couple automation to the manual process that we have been doing, we have really been able to see tremendous improvement in the amount of samples that we're able to turn around at any given time. In addition to the automatic extraction machine that we receive through our public-private partnership, again, we were able to get a 3rd thermal cycler. And this is the actual PCR instrument that we do the amplification on. That 3rd piece of equipment is now, it arrived yesterday. We should have gotten it on Saturday. It arrived yesterday, I was told, when I contacted the brokers this morning, and they are working currently now to get it out of the customs, and we should be installing that in pretty quick time. That new piece of equipment is going to add an additional 320 tests per cycle. So we should be able to turn around at least minimum 512 tests every 6 hours, which really puts us in a good space. Just to put things into context, our daily reception for specimen fluctuates. Sometimes we see as much as 600 samples. Other days, the sample reception may be around 100, under 100. A sweet spot really being around 250 to 350 samples per day. So given all that we have seen in terms of the intervention, we should be able to turn around results within that 24 to 48-hour period. And this is in assuming that the situation doesn't worsen, because if we begin to experience an increase in cases again, where our numbers are going to go up, we can very well find ourselves back into a position where we may have delayed turnaround time for testing. In addition to the instrumentation, just to update you that in terms of testing resources, we do have adequate testing resources on island. We have the critical VTM, the transport medium for sample collection. We have the testing resources that we have just received supplies again for. So we are not threatened by resources in terms of not being able to test. So as far as laboratory is concerned, we are really in a good space right now. And thanks to the Ministry of Health and by extension, the government of St. Vincent and the Grenadines for really supporting laboratory services. I want to speak a little bit about resulting, because that seems to be an area where we are having some challenges now. We have recently revisited the process where we are now sending reports directly back to the team leaders for the community public health teams. And I know a lot of persons are still calling the laboratory, asking for results, but just to say that even if we can give you results, which we don't promote, we can't clear you. So I don't want it to be where an individual out in the community is thinking that if the lab tell him or her what their result is, they can now exit quarantine. And it's not like that. You can only exit quarantine when you are given the clearance from the public health nurse. And that's why we specifically send the results back to that public health nurse. And we encourage the community at large to, once you have a test done, to keep in touch with your public health nurse, and they will issue you that result and also issue you that clearance, whether you have to go back to work or it's just for you to be released back out into the community. Still on testing, our our mandate really is to provide national surveillance for public health, and national surveillance as well. So it therefore means that our primary focus is going to be on testing the public health cases, persons who are symptomatic, persons who are contacts of a positive person, persons who are warded at the Argyle Isolation Facility, as well as the Milton Cater Memorial Hospital. As an added benefit to our service here, we do provide testing services for persons who are traveling the exit screens, but I just want the public at large to know that our focus is not going to be on the exit screens. While we will not deprive you of that service, we encourage you to get your samples taken on time, go through the correct process where you're applying to the task force to have that scheduling done, and to do it in a time frame that is going to allow you to get your results to travel in an appropriate time, because our primary focus is going to be on testing the public health cases. Having said that, I just want to wrap up by saying the Ministry of Health slogan, hands, face, space, and vaccinate. I do champion it, I support it, and I just want to publicly say that I too will be a candidate for the vaccine when it is rolled out in its next segment, whatever. So thank you. Back over to you, PS.
Mr. Samuel, and I just want to reiterate and just to assure you that the setup of this lab, equipping that lab, the staffing of that lab is clearly one of the commitment of this state to fighting this dread disease. And our collaboration, our solidarity with friendly governments also is part. And we're grateful to the Republic of Cuba for sending much needed resource, a human resource, to also help us to make a dent in turnaround time at the lab there. You know that the state continues to respond, notwithstanding we have to take care of our public health interest, exit screening, etc. We will continue to do that, notwithstanding. But we are also championing a public-private partnership where we are also encouraging and supporting private pharmacies to also come on board, especially with the exit screens. But just to assure you that the state will continue and the Ministry of Health will continue its role in the fight against this disease. We have with us today in our midst our Chief Pharmacist, Mr. Levi Walker. You know, we have entered into this phase where we are now focusing on offering the vaccine to our public. And Mr. Walker, our Chief Pharmacist, is now going to give us an update on what we have been doing in terms of our preparation to receive vaccines here in St. Vincent and the Grenadines. Mr. Levi Walker, I will now invite you.
Okay, good morning to everybody, and please allow me to adopt the protocol that has been established. And I'd like to start by announcing that I am one of the proud recipients of the COVID-19 vaccine. I took my first shot on Tuesday afternoon, and as you can see, I am here in good health, in one piece, nothing to fear. And I would certainly like to encourage as much person as possible to get on board. I told somebody yesterday that I feel more confident in taking a chance with the COVID-19 vaccine than taking a chance with a serious experience with COVID-19 virus itself. Having said that, with regards to our preparation to receive and store and to distribute the COVID-19 vaccines, I am pleased to inform that our plans have been moving along very smoothly, and all necessary arrangements are in place to ensure a smooth implementation of these plans. Of course, our particular actions are influenced by the nature and the peculiarities of the COVID-19 vaccines that are available, and in particular, their storage requirements. To shed a bit of light on the context, right now there are about 5 vaccines that are in the advanced stage of market authorization, and these vaccines, they require 1 of 3 temperature storage requirements. The AstraZeneca, Johnson & Johnson, and the Sputnik dry formulation, they require storage of 2 to 8 degrees Celsius. The Moderna and the Sputnik liquid, notice the Sputnik has 2 formulations, the liquid and the dry. So the Moderna and Sputnik liquid require storage from around -18 to -20. And of course, the Pfizer vaccine require a storage temperature of as low as -70 degrees. Presently, we have the capacity to store vaccine requiring the regular 2 to 8 degrees Celsius. We have been doing that over the years, and there are several units that are spread across the country at our health facilities. And in addition, the Central Medical Stores has a large walk-in cooler that can accommodate bulk storage. To further enhance that type of storage capacity, we have on order 2 dedicated large volume vaccine refrigerators, which should be here very soon. Concerning the storage temperatures of 18 to 20, about 2 weeks ago, we installed a dedicated freezer at the Levi Latham Health Center. This is where we have been keeping the Sputnik that we received about 2 weeks ago. And to add to this particular storage requirement, we also have and expect 2 large volume medical freezers that can provide temperature as low as -40. And finally, to address the requirement for the Pfizer, we expect to receive 2 ultra-cool cryogenic freezers, and these are capable of providing cooling temperatures as low as -90 degrees. Of course, these ultra-low freezers, they require special cryogenic gloves to handle the product. Essentially, we have made the provisions to handle all of the available COVID-19 vaccines, regardless of their storage requirements. And considering that it is very likely that we would receive shipments of several, if not all, of these vaccines. In any event, we have a well thought out process, and our government, at the end of the day, will be in a position where all requirements necessary to store and to distribute COVID-19 vaccines, regardless of their temperature requirements, will be adequately fulfilled. Of course, within the next couple of weeks, we'll have enough capacity to store enough vaccines to inoculate our entire population. Just a little bit more information on the freezers. The cost of these freezers combined will be around 400,000 EC dollars. And this would include some accessories like cryogenic gloves and voltage regulators, some syringes, and also we have in that as well 1 generator for one of the health facilities. We engaged 2 suppliers, 1 out of Spain and one out of South Korea. The shipment from Spain should be here early March, and from the South Korea supplier, those should be on the ground within a week and a half. The storage sites that we have identified so far include Bookman Polyclinic, Stuffed Polyclinic, KINGSTOWN, Levi Latham Health Center, and the Union Island Health Center. Our decentralized approach to storage is aimed at improving security of the commodity, to ensure easy access by the general population, and to reduce the logistics to transfer stocks between sites. Also to reduce the crowding and the assembling of staff of clients at a single location. In closing, I reiterate that the Ministry of Health, Wellness and Environment is in a state of readiness to receive the commodities necessary to undertake the task of COVID-19 vaccination in St. Vincent and the Grenadines. And I can end by mentioning that a very important component of our product line as well is a dedicated refrigerated truck that should be landing in St. Vincent and the Grenadines within the next few weeks. Thank you very much.
Thank you very much, Chief Pharmacist. I just want you to see how steadfast the state and our government really go about its business of ensuring that we manage and execute a very effective national response to COVID-19. We have enhanced our testing and laboratory capacity. We have significantly responded and enhanced our ability to receive, store, deploy vaccines. And we are doing so in a fast and assured manner. So you can continue to depend on us and rest assured that we will continue not only to respond, but to do everything in our effort to keep this nation safe. And I said to you the last time, we will not rest, we will not relent until we have conquered this dreaded disease. We have with us today our Honorable Prime Minister. He is going to speak to us today, and he has taken time from his busy schedule to do so. And we are ever so grateful when he's able to join us, because we are quite aware of the magnitude of the task before him. And we're very honored and pleased that he's with us today. I'm going to invite him at this point to speak to the nation. Honorable Prime Minister.
Thank you very much, Permanent Secretary Knights. Good morning, everyone in St. Vincent and the Grenadines. I listened very attentively to the excellent presentations by the professionals. Mrs. Maxine Glasgow-Cottle giving us the statistical update on where we are with COVID-19, and she gave us a very good time series review from December right through to the most recent period on the 10th. That is to say, yesterday. And I'm happy to see that the curve, broadly speaking, is flattening, and there is no time for complacency at the same time. I'm very pleased to hear about the laboratory capacity as detailed by Elliot Samuel, who is the chief laboratory professional. And I was very impressed too with our chief pharmacist, Levi Walker's presentation on our vaccine readiness in respect of storage, what we have at the moment, what is immediately prospective, and how we are setting about that, and the personnel whom we have to carry out this exercise. I heard most of Minister Jimmy Prince. There was a period when the song went. But I heard much of what he said, and it is clear that he has things, broadly speaking, under control, and there's no need for us other than to feel assured and calm. It's just for every individual to do his or her part so that we recognize and we give real life and meaning to the mantra that no one is truly safe until everyone is safe. I want to speak about one or two of the policy issues. First of all, touching on the question of the vaccines. Sometime this afternoon, I suspect Jimmy spoke on this, but I didn't hear this part. But sometime this afternoon, I think at 2:45, a number of vaccines are coming to St. Vincent and Grenadines from Dominica. I think enough to immunize, to give 1,500 persons the jab or a number close to that number. But we'd actually get the actual number finally. But these really for the frontline workers. I don't know if the time has changed from 2:45. That was the information given to me before I came here today. I know that the OECS heads of government, the OECS ministers of health and the OECS commissioners to have a meeting, I believe at 5 today, to put all the relevant, to coordinate all the relevant arrangements, because the government of India is providing more vaccines in the case of St. Vincent and the Grenadines. I got a letter. I got information yesterday from the High Commission of the Republic of India for St. Vincent and the Grenadines, to St. Vincent and the Grenadines, which is resident in Suriname. And the information reads, the High Commission of the Republic of India to St. Vincent and the Grenadines, with residence in Paramaribo, Suriname, presents its compliments to the Ministry of Foreign Affairs and Foreign Trade, Government of St. Vincent and the Grenadines, and has, with reference to a letter dated February the 1st, 2021, from Dr. the Honorable Ralph E. Gonsalves, Prime Minister of St. Vincent and Grenadines, to His Excellency, Mr. Narendra Modi, Honorable Prime Minister of India, the honor to inform the esteemed ministry that 40,000 doses of Covishield vaccine have been approved by the Honorable Prime Minister of India as a gesture of friendship and solidarity to assist the government and friendly people of St. Vincent and Grenadines to fight against COVID. And there are a number of arrangements, items of arrangements which have to be made. And I believe that other countries which are getting from India, they're seeking to see if they could do one kind of a shipment rather than do them individually. Dominica has received early, and so too Barbados. And what is happening is that the Prime Minister of Dominica told me that in keeping with our resolve within the Caribbean community, that whatever little we have, we will share with one another. And we are getting some from Dominica, I think it's this afternoon. I think some are going to St. Kitts and Antigua and Barbuda from Dominica. In Barbados, what they got, they're sending some to Guyana, to Trinidad, and I think Grenada and St. Lucia. It is important for us always to bear this in mind about sharing. And in my letter of thanks today, I just sent off another letter to Prime Minister Modi. I emphasize that particular point, that we are sharing, so that when we get our number, if any other country has any shortfall, we will also try to help. And not only from these supplies, but from any supply. So I would expect that frontline workers would be getting very shortly. So that's insofar as this supply of the AstraZeneca vaccine from India. It comes under the rubric Covishield vaccine, but it's the AstraZeneca. I think that's the name given by it in India. Then, in relation to the vaccine from Russia, the Sputnik, the Ministry of Health is making a statement on its website sometime later today, basically saying that Sputnik V has been authorized in St. Vincent and the Grenadines, and the use of the vaccine is approved under the emergency use authorization procedure. And then there's going to be a statement by the Russian Direct Investment Fund, that's the Russia's Sovereign Wealth Fund, announcing the approval of the Russian Sputnik V vaccine against coronavirus in St. Vincent and the Grenadines, which is the 25th country, which would have given you apply the emergency authorization procedure without additional clinical trials in the country. And these 25 countries are, of course, Russia, Belarus, Argentina, Bolivia, Serbia, Algeria, Palestine, Venezuela, Paraguay, Turkmenistan, Hungary, United Arab Emirates, Iran, Republic of Guinea, Tunisia, Armenia, Mexico, Nicaragua, Bosnia and Herzegovina, Lebanon, Myanmar, Pakistan, Mongolia, and Bahrain. And this vaccine has been identified as having an efficacy of 91.6%, as confirmed by the data published in The Lancet, one of the world's oldest and most respected medical professionals, published in the United Kingdom. The Ministry of Legal Affairs, I saw yesterday a further instrument which should be published today, statutory rule and order, with the number of vaccines, different vaccines, given the emergency authorization under the Public Health Act as amended on April the 7th last year. So not only are we having the Ministry of Health doing its work, they're coordinating that work with the Ministry of Foreign Affairs, coordinating that work with the Attorney General's chambers, with the Ministry of Finance, and so that we are doing everything together. Angie has just given me a further update. The flight is not coming today. It's coming at 4:10 p.m. today rather than 2:45. And the number of vaccines which are coming would be for 2,500 persons. So which is quite generous out of the lot which they have had, so that we're going to be able to do we're going to be able to do all the frontline workers plus others from this 2,500, for this 5,000, for the 2,500 persons, 5,000 vaccines. That's very good. I have to call my brother Rosel Skerritt on this. I spoke to Mia yesterday, actually, to indicate to her that she didn't have to send any to St. Vincent because we were getting from the number which had been sent to Dominica. And as I say, when ours come, if there is any country which has any shortfall, we will also share. This is a basic principle, and this is it is a tremendous act of solidarity. Whatever little we have, we share with our brothers and sisters. So that's the Sputnik. You know that there are 3,000 persons, doses for 3,000 persons should be coming first. That is to say, 6,000, I believe they're going to come in batches. They're probably going to have a thousand of the vaccines coming there for 2,000 persons of the Sputnik, and then out of that requirement for 3,000 persons, they will come. And as I indicated in other media, that I've written through the ambassador and also the Russian ambassador to St. Vincent and Grenadines, based in Georgetown, Guyana, and also directly to Foreign Minister Lavrov, and also working with an intermediary to see if we can procure up to doses for 70,000 persons. In addition, as I indicated before, we are having, through the Mustique Charitable Trust, we have given the authorization for the chairperson, Dora Lowenstein, to procure up to 100,000 doses of AstraZeneca out of the United Kingdom. And I expect a report sometime today or tomorrow as to how that process is going. I indicated before that we are also on the African medical supplies platform, where they're buying in bulk, and 1.5 million doses are earmarked for the 6th region of Africa, which is the Caribbean, out of which St. Vincent and the Grenadines will get and pay for over 21,000 vaccines. And then anytime within the next couple of weeks, certainly hopefully before the end of February, the first tranche under the COVAX system with the AstraZeneca vaccine. This is the British, Oxford, the Swiss vaccine, a European vaccine, which yesterday, incidentally, has been given the green light by the WHO, the World Health Organization group of experts. That number, which will be coming to us from the first tranche of the 45,600 available for us under the COVAX, will be 11,000 and something. And that should be with us anytime, particularly soon. And then, of course, through ALBA, there is a revolving vaccine bank of $1 million US. And we are waiting to see what will happen to the Cuban vaccine, the Sovereign, which is going through its 3rd stage clinical trials. And I think they're going through that in the month of March. I have given a range of vaccines, and the numbers I'm calling there will be more than for the 70,000 to inoculate the 70,000 of our population, which is the number which I'm told, I'm advised, will provide what is called a population immunity. But we have to identify sources on an ongoing basis, because the efficacy of these vaccines would be for 9 months up to a year, and then you'll be taking vaccines again, or at least a booster. That's what I have been advised. So if you hear that the numbers are adding up to more, it is only prudent for us to do so, particularly in the context of what you may call vaccine nationalism, wrapping itself around several developed countries. Now, I should point out in relation to the Sputnik, they are in communication with the Epidemiological Institute in Moscow. The relevant one is in touch with WHO, and they're having their pre-authorization discussions. In the budget for 2021, there are lots of resources which we have put aside for COVID, including the $1.6 million grant which we are getting from the Republic of China and Taiwan for purchasing the COVID vaccines and for cold chain equipment. And we had specifically asked for if we can use the money not only with vaccine, but some other items of cold chain equipment, and that has been approved. In fact, I got information yesterday, and Taiwan has acted very promptly on this, taking into account their long Lunar New Year holiday. And we have to thank them. And we have to thank the Indian government. And we have to thank all those involved in COVAX, the Mustique Charitable Trust, the Russian authorities, and the intermediaries, ALBA, Cuba and Venezuela. I should point out that the ALBA Bank has approved a grant of $200,000 US to add to us. Also for vaccines. That money should have been placed at our account, at our central bank by the ALBA Bank. St. Kitts, Antigua, Dominica, and Grenada also will get a grant up to $200,000 US. We have additional staff, nursing, because as we have the capacity, as you heard from Elliot, Samuel, personnel and equipment and all the items to carry out the tests. And I was very interested, he said that the modal range, the cluster, the modal range statistically is between 250 and 350 per day. Samples, it occasionally it may go up to 600. In fact, I've been noticing the numbers. Since February, they have been in that particular range of 260 to 333. I think that's the largest set of samples I've seen in any day from the day 0349, which is before me. I think that what we have to do much better is to, and I heard Elliot, and they're clearly, that's a very good step in terms of the clearances and to provide the information to the districts so that the persons can get the information through the entities which collected the samples. I think that would make a good improvement. We have to, in addition to the technical work of doing the testing, we have to make sure that the information gets out to people. And now that the backlog has gone, I'm sure that we will get on a daily basis how many samples came in on a particular day, how many, well, all of them should be tested on any day within the 24, 48 hours, and how many of that are positives and positive and the like, because people are concerned about the reportage. And so that aspect of it, we need to manage even better. I just want to remind everyone that the government had been advised, I personally had been advised by the technical people in the Ministry of Health that first of all, we must do early identification. We must do the testing. We must identification, tracing, testing, communicating the results of the testing. We have to do the quarantine or the isolation. And then we have to provide supports. And in addition to that critical bundle of functions, we have to have the additional staff, which we have provided. There are 23 additional nurses in this year's budget. They have already been recruited. So I've been advised, and if all of them have not yet been recruited, they ought to be recruited, all of them, pretty soon, because the resources are there. And the Cuban government has provided additional persons to help us to do the testing. Those 4 Cubans have now come out of quarantine and they're up and running and working in addition to the existing staff. I know that supports on the administrative side have been provided, and I've been talking to the Cabinet Secretary about that. That is to say, on the administrative side at the molecular lab. It leaves me now to urge all the persons to abide by the protocols and follow them so that you don't have to be ticketed for any of these matters which have been put in the public health, the COVID-19 rules 2021, which were published, which were gazetted on the 5th of February. And if we do the mask wearing, we do the hand sanitizing, and we have the physical distancing, you notice from the rules we excluded the churches, and that's a deliberate decision, and we are talking to the churches. I'm to have a meeting sometime early in the week, hopefully. If I can get it perhaps tomorrow, it's a Zoom meeting with the important church leaders, well, as many as we possibly can have, so that we discuss this matter, so we can regulate better the numbers in the churches and the protocols to be applied. Leaves me to thank all those who have been working together on this matter. And I'm very pleased to see that on the data provided, the absolute numbers, and very much so the curve on the what Maxine Glasgow Cottle provided, to see that there's a big trend downwards of the curve, and it is coming closer to the horizontal line, and that is that's a good sign. We just have to make sure we do all the fundamentals and keep things going like this. And I'm just urging persons not to go about unnecessarily creating dissension about nothing. I mean, I heard people talking about the nurse who gave Eloise and myself the vaccine, that she didn't have on gloves. Well, she didn't have to have on any gloves, because the hand sanitizer there, she hand sanitized her hand before she did Eloise and after she did Eloise. And when she finished doing me, she hand sanitized again. She did before me and after. I mean, and persons who don't know how to do these things, they sit down in front of a computer, they're just gonna telephone and call. And you know, it makes no sense, this sort of a nitpicking. In fact, it has reached a stage now that I'm completely immunized against it, because you just don't pay any mind, because it's now some of it has become so senseless, and some of the bickering is really unseemly, and we must stop it, and just let us do the right things as we have determined on the basis of the advice of the health professionals. And this constant attack on the chief medical officer, or on the medical officer of health, or on the nurses and other frontline workers, I mean, those who are doing it must stop it. It is wrong. Thank you very much.
Thank you so much, Prime Minister, for updating the nation on such a very important aspect in our national response, that of vaccines. You have touched on very important policy matters. You have updated the nation on the allocation in this year's budget, the estimates, the monies that are there for us to continue our response. He has spoken about what we have been doing in terms of our partnership and acts of solidarity and partnership with our friendly government. You have mentioned that. And you have touched on the very presentations, what is happening in the lab and the epidemiological situation with respect to COVID here, and we thank you so much. I just want to join and support what you have said. We are all Vincentians. It is time that we stand together and that we act responsibly in the face of a crisis, which is not only confronting St. Vincent, but the world. Nitpicking at little things, poking holes at little things, it's not going to help us. We need to stand resolute. We got through the 2013 floods. We got through Thomas. We got through a volcanic eruption here. We will go through this. But all hands have to be on deck. But for those who may not want to be on deck, I can assure you, by large, the majority of Vincentians are on board, and we will push ahead and we will prevail. I want to thank the Prime Minister. I want to thank our Minister of Health. We will be fielding some questions from the press. I also would express some thanks before we conclude today, because they're very important persons who have been contributing to our efforts, and we are so eternally grateful. But we have gotten to that stage where we have members of the press who are joining us today, and we will invite you to ask your questions. There might be some questions that are posted in the chat. We will pick those up and we will mention those. So at this point, I will open up the floor and I'll ask for those who have questions. Please ensure that you indicate your name, indicate the organization that you're representing, and then you can let us know what question you have and we will respond to such. Thank you.
Good afternoon. My name is Bria King from the Searchlight newspaper. Several returning nationals have complained in recent times about the high costs attached to the mandated 14-day quarantine stay at the Ministry of Health tourism-approved facilities, particularly when they have what can be deemed as adequate facilities at their own home, and that positive COVID-19 cases are allowed to isolate at home. Why are returning nationals who enter with valid negative PCR tests still required to complete 14 days in a Ministry of Health / tourism approved hotel or facility? And my second question, will protocols be different for travelers coming to St. Vincent and the Grenadines who have already received the COVID-19 vaccine?
I'm wondering, Brother Knights, if I can answer the first question.
Go ahead, Prime Minister.
Because it's not so much well, it has some technical question, but it has policy issues in it, apart from technical. The second one is a technical issue with those, if the CMO is on. The CMO is on? The CMO, if she's on, she could answer that probably, or whoever. Look, Bria, every single country in this world imposes restrictions on persons coming in to their country. Every single one. Some countries started in the region by paying for persons to go in quarantine in hotels. St. Lucia did that, Jamaica did that. They have to back away from it. We see the United Kingdom now from 33 specific countries. They're doing it, what they call the red list countries. They're doing it, they're saying if you're coming from those countries, you have to go and quarantine in a government-approved hotel. And the cost of it for the 10 days which they're giving is £1,750 Multiply that by what is $3 and something cents now, easy to £1. And further to that, you know what the British government just did recently? They passed a statutory rule and order. If you lie If you tell an untruth, you make a false declaration where you're coming from. For instance, Brazil is on the list. South Africa is on the list. If you come from those countries and you put down you came from St. Vincent and the Grenadines or Barbados or Antigua, you could be fined up to £10,000 and up to 10 years in prison. This is Britain, you know. Well, my own view of that is that that sounds disproportionate, but that is what they themselves, that they have determined. Bria, there is a variant in the United Kingdom, which is already in St. Lucia and in Barbados. There's a variant from South Africa, from Brazil. The world is a one place. Even if you have a negative PCR, as we have seen, coming from outside, you don't know whether at the moment when you land, you don't have COVID. Because between the time when you get the negative PCR, 72 hours, to the time when you land in St. Vincent, you have interactions, you don't live on Mars. And what the health authorities have advised, they would want to make sure that that particular, those variants, which are very difficult, very challenging, that we keep them out as far as is practicable. And that it is easier to contain what you have internally than what you bring in from outside, from an epidemiological standpoint. And this, you know what I find inconsistent with those persons who make that argument? Some of them are the same persons who say, you must lock the borders. So you must lock the borders, don't allow people to come in. But if you insist on quarantining those who come in, that is a problem. So what you must do, you must provide quarantining for all Vincentians in a state facility where you have who have COVID in St. Vincent and the Grenadines. If persons don't see the rationale and the judgment and the proportionality there, well, then I can't help. Those are, and incidentally, that is not a matter. I see people talking about inquiring in a court. What that policy has to do with an inquiry in a court? If you want to go to the High Court to see whether a restriction of that nature is reasonably required for the purpose of protecting the health of the country, and that it is reasonably justifiable in a democratic society, well, go to the High Court with a constitutional motion. And I would like to see if there is a judge of reasonable temper who would say that those restrictions are not reasonably required for the protection of health, and that they are not reasonably justifiable in a democratic society. I just give a broader scope what is happening regionally and nationally, I mean globally, and talk about the British one. What all that is about, I'm telling you, are persons who want, for other agendas, other reasons, to be carrying out these arguments. I don't think the argument has any reasonable merit. And until I'm advised to the contrary by the public health officials, those regulations remain in place. Thanks.
Thank you, Prime Minister. We will have the Chief Medical Officer to respond to the second question.
Good afternoon, everybody, and thanks for joining us today for this update. In response to the question about persons who come who want to travel to St. Vincent and the Grenadines after having been completely vaccinated. So they've received their 2 shots if they're coming from the States. So they have gotten 2 shots of the Moderna or the Pfizer. So they have certification that they have been completely vaccinated. The consideration would be that you would still need to come with a negative PCR test. You will still need to have a PCR test done on arrival, and we would consider shortening the quarantine to 7 days. The research thus far suggests that the vaccines, though they might decrease the possibility of being infected, they are not decreasing completely. So you can still be carrying the virus, and so you can still pose a risk to us. So the considerations, and as I'm saying, we are still deliberating, and we still have to be guided. But for now, you would still require the PCR test, a negative one, to come in. You would still need to have one done on arrival, and you would still have to do some quarantine. But that quarantine might be shortened, and then after you continue with strict mask use. So that's the response.
Thank you very much, CMO. And we are also very grateful to you for really and truly the perspective you have on this matter. And we're very grateful to you for your very hard work. You are indeed a very good example of what this nation has been doing in terms of its fight against COVID. Many may not know, but you have worked consistently, not only researching, but also writing, advising. And please know that we are all firmly behind you and we support you, the work that you have been doing. Notwithstanding what others may say, we understand what you have been doing. Okay, we will now welcome other questions.
Hello, good afternoon. My name is Kenton Chancellor of Eyewitness News and the Caribbean Media Corporation. Can you hear me?
Yes, sir. Yeah, we can hear you loud and clear.
Yes, good afternoon, everyone. I have just about 4 questions, some of them interrelated. How many persons, and I would ask the questions at once and then get off the line and allow for the answers, probably in an omnibus manner. How many persons, if any, who are in custody at the nation's prisons have tested positive for COVID-19? That's one question. Another question is, we have had 6 deaths, regrettably, as a result of COVID-19. What are the protocols for the final rights of persons who have died as a result of COVID-19? And I mean outside of the protocols relating to mass gathering. Are there any specific protocols about how those funerals are to be conducted? There are a number of persons who, for various reasons, are skeptical about taking any of the vaccines. What are the ways in which these vaccines help those who take it, those with whom they associate, and the community at large? And finally, notwithstanding the Prime Minister's answer to my colleague's question, I understand the point about the country trying to prevent the variants from entering St. Vincent and the Grenadines. I'm still trying to understand what is the reason, what is the thinking of health authorities behind allowing persons who test positive to isolate at home, in some instances, in houses where the ideal isolation arrangements cannot be undertaken. Thank you very much.
I'm wondering if the last question, which is essentially a follow-up to Bria's, which Kenton is raising, the health authorities can also speak towards it. The fact of the matter is this: there are homes, there are a small number of homes in this country where you may have a problem with somebody who is positive, where they cannot be properly quarantined away from others, and who may be particularly vulnerable. And in those circumstances, there are 30 rooms available, and those rooms have been available for about 3 weeks now for persons to go. That's it. You may be positive, you're not sick, in the sense of having to be hospitalized or having to go in isolation. And to the best of my knowledge, there are only 6 persons there at the moment. At least up to this morning, I was told that, and that had to be confirmed. You see, the fact of the matter is this: in the year 2001, the census shows that you had about 30,000 houses in St. Vincent's, households in St. Vincent and the Grenadines, with about 4 persons, close to 4 persons on an average to each household. By 2012, you had 36,000 plus households. 3 persons per household on an average. And since 2012, on my calculation, there's an estimate of about another 5,000 houses which have been built. So that you have on an average, I will say 2.7, maybe 2.8 persons per house. Now, what has to happen, and if you watch the statistics, Kenton, and the statistics are very interesting. Cases by age group. What are the bulk of the cases? The clusters are really between the major ones, between 15 to 24, 173 persons. 25 to 34. This is data just provided here by Maxine Cottle. 25 to 34 age group, 237. 35 to 44, 206 persons. Well, there's no report that any person in any of these age groups has gotten very sick. So what these persons have to do is that when they're in households, they make arrangement inside of the households to quarantine, isolate themselves from persons who may be older and more vulnerable. And if you look at the numbers, 55 to 64 age group, they're 98. 65 to 74, 62. 75 to 84, 13. 85 to 94, 6. 85 to 110, 3. In short, the bulk of the COVID cases are between persons between the ages of 15 and 44. That is what this data show. In the individual households, there is enough space for persons to properly quarantine. But you have to take a responsibility inside there. It is not practical to put everybody who is tested positive in a hotel or a government facility. First of all, a lot of people are not going to want to go. And you're not going to be able to compel them, because we have a place now where you can have 30 in 2 places, but you only have 6, because people don't want to go. They prefer to quarantine in their own homes, and they can do so, but they have to do it properly in accordance with the protocols. Kenton, we have to be data-driven. We have to be scientifically driven and not be swayed by positions which don't have as the basis of decision making facts and science. No, I'm telling you from the standpoint that I am seeing it. The medical persons could also come. But you began the question by saying, notwithstanding what I said. Well, it can't be notwithstanding what I said. You have to say, in addition to what I said, because you can't dismiss what I said by just saying notwithstanding. Because you're telling me what I was talking, the answer which I gave to Bria is entirely unsatisfactory. But that is not, you end up asking because you're asking about what is the basis not to have them. Those who are tested positive not to go inside of a facility otherwise than their homes. I hope I have answered as well as I can. You may not agree with me, but if you don't agree with me, so be it. We can't agree on everything.
Thank you for the response, Prime Minister. We will ask Mrs. Maxine Glasgow-Cottle to provide a response to the first question, the number of persons in prisons who have been tested positive for COVID-19. Maxine?
Hello, responding to that question. So far, we have seen 2 cases, 2 persons at the prisons were tested positive. Gosh, I don't know how to.
Thank you very much. Thank you very much, Ms. Patel. We have.
Sorry, Brother Knights. I think that Maxine is referring to 2 males, but I think at an earlier period, there were a few females. And I think, as far as I know, they have, since then, they have been tested negative. At least that's what the information came to me. Can't remember how many of them, but it wasn't too many of them. But I think the 2 relate to 2. I think the 2 relate to 2 males. I want to. If she doesn't have the numbers at hand, she can get them, because there's no. We say what the numbers are.
We'll verify that before we leave today.
But it's an important issue always to be tracking what is happening in places like the prisons.
Correct. Right, correct. Okay, thank you very much. We do have 2 other questions. One which refers to arrangement for the burial of persons who have died as a result of COVID-19. And we have the other question which speaks to persons who have taken the vaccines, how this could be of benefit to them, persons who they're probably come into contact with, and maybe their community by large. So we will ask Dr. Charmin Bailey Rogers. She is a registrar here in the Ministry of Health, Wellness and Environment. So we'll ask her to provide an answer to these 2 questions. Ms. Rogers?
Good day to everyone. In response to the question concerning the arrangement for burial for persons who have died with COVID, we would just like to say that the funeral homes have been trained to collect and to handle the bodies appropriately, and that burial is usually closed casket. In response to the other question, the benefits of persons taking the vaccine, we would just like to say that persons who have taken the vaccine would definitely have a decrease in the severity of contracting if they do contract the disease, and also there's a decreased likelihood of transmission in the community to other persons. So we are encouraging persons with comorbidities such as hypertension and diabetes, who are more likely at risk of dying or getting a severe pneumonic infection or other complications from COVID-19 we are encouraging them to take the vaccine, as it would definitely protect you and at large protect the others around you.
Thank you very much, Dr. Rogers. And essentially, you heard the point. Taking the vaccine, it decreases your chance of having any severe illness reaction to COVID-19, and it decreases your chance as well of being of any negative impact to others who are around you. Okay, so we are grateful for those.
May I just say, Brother Knights, as a practical matter, and away from the technical answer by Dr. Rogers. Look, we have our children take the measles, mumps, and rubella vaccine before the age of 5 to go to school. You have a handful of people who say they don't want their children to take it. If they don't do that, they homeschool their children. But once you're coming into a educational facility, public educational facility, you have to take the measles, mumps, and rubella vaccine. Persons have been taking vaccines for polio. People have been taking vaccines for yellow fever. We take vaccines for all sorts of things. I have to travel to Jamaica or an African country, and the regulation is yellow. A couple of years ago in Jamaica, they had an outbreak of yellow fever. I went and take my booster because I had one sometime many years ago. Similarly, if you suspect that you had some food contaminated by a rat, and it's you're having, you worry about leptospirosis, or you have it, you intake something for it. I mean, it's either we're going to believe in superstition or we are going to believe in the science. Everybody knows, or in my view, every reasonable person knows that when you're taking, that if you didn't have vaccines, people's lifespan would have been much shorter. This is another vaccine. And it's a vaccine for a virus, which is not an automatic death sentence. It's a killer, to be sure. But we see the persons who have died here in St. Vincent and Grenadines are those with severe comorbidities, severe ones. So I'm talking purely as a practical person, talking to the ordinary man and woman in St. Vincent and the Grenadines, people of a reasonable temper. Now, there are others who feel very strongly that they don't want to take any vaccine. Well, they can go ahead. All I'm urging our people to do is not to bother them if they don't want to take it. Nobody's going to force them. Nobody's forcing anybody to take the vaccine. It's a voluntary program. But on the basis of the science which is available, it is wise, it is sensible to take the vaccine, both in relation to what is reported in the science. I would have to believe that all the scientists in the world, at least the mainstream scientists, are manipulated by some evil set of figures and some conspiracy. I don't believe that, and I don't think reasonable people will believe that or think so. And I want to say, I value my life. I am 74. I'll be 75 this year. I want to live more years, although that I have lived more years than I have remaining left to live. I have taken the Sputnik vaccine because I am satisfied not just with the reports coming out from Russia itself, which I've read, but also in the Lancet magazine, the journal in the United Kingdom, a reputable journal, and our people in St. Vincent and the Grenadines, the epidemiologists, the medical people who deal with these matters, they advise me and say that all of these vaccines are safe. With the ones, the Sputnik, the AstraZeneca, the Moderna, the Pfizer, and of course, well, they didn't advise me on the Johnson & Johnson, the Johnson & Johnson, the Johnson one. But I am, you know, if a reputable entity approves it, I don't have a problem also with it. But of course, I'll have to get the advice of the medical personnel to provide also emergency authorization. But all the time, these vaccines are given to you voluntarily. This particular COVID vaccine, any COVID vaccine in the country, we're not making it mandatory. In relation to measles, mumps, and rubella, it's not compulsory, you know. You don't have to have your child take it, but you homeschool your child. Because the science says you don't let go a child who doesn't take the vaccine among other children, where you may have a problem. So from a public health standpoint, you do that. But the policy is not to give it. Who don't want to take it, the vaccine, you don't have to do it compulsorily. Who don't want to take it, don't take it. But I believe the vast majority of people in St. Vincent and the Grenadines will take the vaccine, despite attempts by anti-vaxxers or persons, even though they're not anti-vaxxers, who have a skepticism. The science tells us that it is sensible to take it.
Prime Minister, for the practical perspective on this question. We will, if there are any other further questions, we will welcome those at this time. Okay, if those are all of the
Hi, good afternoon, Larissa here, SBDTV News. I'm not sure if you heard.
SBDTV News. I didn't get the name, sorry.
Yes, Larissa Pugsley Kidd. I've noticed that your data show that there's now a decrease in positive cases, and the curve was flattened during the 22nd to the 25th, which was on the public holiday. Could it be that this was due to the fact that flu clinics were closed except for the Kingstown clinic, which was on Saturday, or has this been a positive impact on the decrease?
Okay, thank you very much for the question. Just hold 1 minute first. Let us see, at this time, we're trying to get a hold of the epidemiologists who work the numbers to give us an answer. Tamara Bob. Let's just see if she's on. Give us a few minutes.
Okay.
If you have any other question, you can pose that while we are.
Okay, yes, my other question is, the interferon drug from Cuba, was that used or administered to COVID-19 positive patients?
Okay. Any other question?
No, that's it. Thank you.
Okay, thank you for the question. I'll have the CMO to respond. Thank you.
Okay, so good afternoon again. I was holding on for the epidemiologist. The sample taken, yes, it was reduced over that public holiday weekend. We did, however, run clinics we collected samples, about 120 samples were collected on the Friday. We had a flu clinics on the Saturday, still going on. The polyclinics were open. We didn't collect any samples on the Sunday, but we had some collection on the Monday. So even though all of the clinics were not open, and that would have accounted definitely for a decrease in collection and so results during that period, we did have some collections still, but definitely the 28th was stands out throughout all of the sites. That was a date of increased positives. And the other question was the interferon. No, we have not used interferon to date for the COVID patients.
If I may just, Simone, we are all gone.
Yeah.
There seems to be a break. Simone, if you could help me here in follow up to what was asked there. I'm sounding like a journalist now. I see on the information which the sheet I have in front of me, on the date what they was talking about was the 24th of January. Yes. Friday the 24th. Huh? What was the weekend? What weekend we gave?
It was before that.
Was it the?
It was actually the 21st. Was it 22nd? The
22nd to the 25th.
Right. Yeah. So that's
the 22nd to the 25th.
Yes.
Well, I see on samples taken on the 22nd was 205.
Okay.
For which 41 were positive. On the 24th, 121, which is the date I think you're talking about. The number of positives 2. I don't see the number for the 25th. And then on the 26th, 440, and the number of positive cases 34. On the 28th, you had 513 samples taken and 115 positive cases. What the question is this: when we say samples taken in the data which have been provided, that means samples actually taken on that day. That's not an accumulation of other days, and they have only to be tested on that day.
So the figure is it's the number of samples received in the lab.
Okay.
On that day. That's normally what the figure is.
Okay, the samples taken on that day. Okay. Well, that one on that day, the positivity rate, the 28, and everybody is quite correct when they speak about that, because the positivity rate is 22.4%, which is the highest positivity rate which we have had. And the numbers are declining basically since then. Now, the positivity rate, I take it, is the number of positive cases as a percentage of the samples taken.
Or the samples taken, or the samples tested on that day.
On that day, or the samples run on that day. And how do you calculate the incidence? The incidence now is the number of positive cases multiplied by 100, roughly, approximately, for the population.
For the population. So it depends on the population at risk. So for us, the incidence rate would be the population of St. Vincent and the Grenadines, because that's the entire risk population.
Okay, so that So on the 28th, and I'm saying this not only for my own edification, but also for that of journalists, those who may not, well, those who are brighter than I am will figure it out, but just for actually on the 28th, where you had 513 cases and 115 number of positives, that is 22.4%. That is the number of positives over the number of samples taken. But the incidence would be 0.11, which would be multiplied roughly by 100, because we have 110,000 people. Huh? That's the way you do it.
That's the way. So it's there.
Okay, okay. So that when we talk about positivity, we know what we're talking about. When we talk about incidence, we know what we're talking about. Okay. Thanks.
Okay, the CMO, I didn't quickly respond to why was the interferon drug not administered when initially that was what it was, well, was announced as supposed to be given to people.
Okay, ready? Okay, the interferon initially in the early stages, as you remember, the management of COVID-19 has changed, has transitioned tremendously, has changed a lot over time. The initial management, the proposal was that the interferon would be used. The interferon also, the method of use is for the nebulization. And that you know, for persons who have asthma, that would be you put the drug in a cup and you use oxygen to propel the drug into you. The challenge with that is by propelling this drug into you, the person breathes in and out. There's also the risk of infecting persons because you now have an aerosolized situation going on where the virus is moving around in the air. And this is the most dangerous point of care for caregivers in terms of the risk of transmission. So that was one. Additionally, the interferon, as to when it would be used along the process, it has to be used at a very early stage. And so for now, we have not. And also, the progress, as I said, in terms of the management, dexamethasone, a steroid, a very old drug, but a very effective drug, has now been proven to be really what you really need to use for persons when they're ill. And we have dexamethasone, and it's what we have been giving our patients here when they're admitted and they require that sort of intensive care. So we have not we have not used the interferon at this stage, but that doesn't mean we are not utilizing some of the more effective, what we now know to be extremely effective for management.
Okay, thank you very much. And quickly, do you have an update on the new variant from UK, if it's here in SPG?
No, we still have been sending samples. We continue to send samples up to yesterday, Wednesday. We sent samples to CAFA because we continue to verification, and we have not yet received anything about the UK variant being in St. Vincent. Okay.
CMO, if I can just add to that, please.
Yes, please.
Right, just to say that we also have in lab, which was given to us by the Pan American Health Organization, a multiplexing kit. So we can now be testing locally for the UK variant as well. We can't do characterization, but we can have a very good presumption as to if we are dealing with a UK variant, and we can now reflex those samples onto CAFA. So that kit has been implemented in lab as of this week, where we're actually doing active surveillance for the UK variant, and we haven't seen any so far.
Thank you very much for those questions. Are there any more questions at this time? Okay, so I would thank us all for being here. I really think we had a very good conference. And we provided the latest update based on the information and the data we have before us thus far. We are very thankful again for our minister to have led us through this process, for our Prime Minister for adding much value significantly to this press conference, to the staff in the Ministry of Health, and particularly would like to thank what I call our team COVAX. They were excellent. They have done tremendous work. They've helped to brought us to the stage where we are in an advanced stage of readiness to receive our vaccine. I really would wish to thank them. They have worked very hard. I really would like to reiterate again, thanks to the government and people of India, Cuba, Republic of Cuba, Republic of Taiwan, China. Thanks very much. The Mustique Charitable Trust, Action Beckway, Rudy's Electronics, thanks much. All of your great efforts and contribution to us so far. The government, the people of Dominica, I think the Cabinet Secretary stands out for tremendous support. And there's so many persons that we just wish to thank. And I, in particular, went through these names and to thank these persons because it goes to show that if we all work together in a way to contribute towards the effort of the state, this can make a significant difference. I again appeal to us all to recall the protocols, abide by the protocols. They're very simple protocols to follow. And let us try our best to stay safe and to stay well in all reasonable circumstances. I again appeal to us all for reasonable judgment. Let us all act responsible. Let us all act as a united people in the face of adversities. I'm very much aware that there will always be the minority. I'm very much aware that there will always be critics, but we welcome positive criticism. We are open to suggestions. We are open to your ideas as to how we can best do what we're doing and how we can improve. But the salient point is we need to stand together as a people because this is a situation which confronts us all. Our children, our parents, our elderly, all of us. So let us please just put aside a little nitpicking and poking holes here and there. But we welcome the positive criticism. But first and foremost, let us stand together, let us stand united in the face of adversities. Again, as our anthem said, our faith will see us through and we will prevail. Thanks again. We'll be coming to you again next week with further updates. Thank you so much.